Welcome to the Nursing Post podcast, All Nursing All the Time with Ashley Moore and Rosa Horsley. In this episode, we will discuss the at-risk population and recovery so you can help your patients and loved ones make informed decisions.
You wake up from a hacking cough, you're feeling short of breath, and you have a fever. You think to yourself, do I have COVID? Do I have the coronavirus? This is a question that plagues patients every day. Do you know the answer, Ashley?
I don't know if they have COVID, but I can tell you who should be tested for
Awesome.
COVID. So there is a complete diagram on the CDC website on who should be tested and in what order they should be tested. And of course, the priority goes to the hospital. The patients who are in the hospital who are either in a life-threatening situation or at high risk for a life-threatening situation, they get priority testing. And then after that, your healthcare workers.
Because they are the ones taking care of those critical patients in the hospital.
Exactly. And so after that, it jumps to a second level, which is patients who are in long-term care facilities.
Assisted livings.
Right, because
Independent livings, because of the cluster.
Everybody is in such a tight quarters,
Mm-hmm.
and anytime any virus or illness goes through a nursing home, if you've ever worked in one or been with somebody or had a loved one that was in a nursing home, you know it just ravishes through the whole
It spreads like
community.
wildfire.
Absolutely.
Mm-hmm.
And then after that, you have patients who are like 65 and older with comorbidities.
Which we'll talk about here in just a little bit.
Right. And then after that, it drops down to critical infrastructure workers. So your essential personnel who need to be at work, who are sick. They would then get tested. And then healthcare workers or first responders that are sick with mild symptoms, I should say. And there is wide community spread. And lastly, just individuals with mild symptoms with wide community spread can get tested if there's enough testing kits.
So let's talk about community spread.
Sure.
Community spread in this instance means that you have never left your current country that you're living in.
Right.
You haven't been in contact with anybody knowingly having the virus.
Right.
Because people can spread this
Mm-hmm.
from one person to the next without even showing any symptoms.
Right.
So that boils down to the community spread.
Exactly.
You don't know where you got it. You've never been in contact with anybody that you knew had positive results.
Right. So pretty much you essentially picked that up when you went to the grocery store or something like that. You were in line for something. That's when you picked it up. You do have to understand that the priority of the testing is going to go to the sickest patients. You are not getting tested right now in the United States that I'm aware of.
Willy-nilly.
If just because you want to. It's just not going to happen.
It's not.
There's not enough testing kits for that to happen. And a lot of people want to know what should they do. How do they know if they should be tested or not, depending upon what their health looks like. Most areas, if you have a hospital that's near you, there is a really good chance that they're going to have a COVID hotline that you can call, speak to a nurse, and say, this is what's going on with me. This is my history. Should I be tested?
And in the bigger cities, you can actually Google.
Mm-hmm.
In California, I think you can actually Google your signs and symptoms, and it leads you
To the
the appropriate place.
Right. I knew they were working on getting that set up. And so it takes a while if you are tested because of the influx of results that everybody wants and all the kits going to these labs. It's just taking a long time. There's a big delay. And right now we're looking at 5 to 7 days to get results back.
About 5 to 7 days. And I think that's even being positive.
Sure.
I think that's being positive.
Absolutely. And that's one of the things that you have to understand is if you're sick and you are waiting for results, you need to treat yourself like you're positive. You need to self-quarantine. And anybody who swabs you is going to give you a handout that tells you to go home and self-quarantine and tell your immediate loved ones that they need to do that as well if they've been in direct contact with you.
Absolutely. If you have a temperature right now, you should not be going to work.
No.
This is
Absolutely
not the
not.
common cold.
No.
This is not the flu. If
No.
you have a temperature
Mhm.
and that's above 100.4,
Mm-hmm.
you should not be leaving your home right now.
Right. And a lot of people, oh, I'll work sick, it's this, it's that. You just can't take that risk because if you infect your coworkers, that can devastate an entire small business.
Just empathize, not sympathize, empathize
Right.
if your family or you were the one who tests positive.
Right, because you don't know what people have going on outside of work. And that's where I'd like to talk about the people who are at risk, because if they have these comorbidities, then
It's a lot more complicated.
It really is.
It hit the fan, literally.
Right. Exactly. So if you are around somebody who's 65 years or older, they're at a higher risk for complications from COVID. These are people who are at higher risk from complications. Pregnant women and people who are homeless, they have a higher risk.
Well, I think we need to think about this. I think sometimes people think, oh, it's because they're homeless. Yes, they're homeless, but they also probably don't have an income coming in. They don't have health insurance.
Their diabetes is not being managed.
Controlled. Their hypertension is not being controlled. So
access to proper hygiene,
correct,
limited. Anybody who has a lung disease, moderate to severe, if you have like COPD or asthma, any kind of lung disease, there's a huge list that we could get into with that. But if you have a chronic lung disease or if your patient does and they're at risk, this is a respiratory virus.
Illness, yeah.
Yes. Heart conditions, of course, that they're just at a higher risk as well. And people who are immunocompromised. And that is another long list of people
who qualify under this category.
Yes. People who are on steroids all the time. They're immunocompromised. They have cancer.
They're receiving cancer treatments or drugs.
If they've had a transplant or if they're being worked up for a transplant. If they're being worked up for a transplant, some organ does not function correctly. So
if they're, severely obese. If they have diabetes, if they have hypertension, if they are diagnosed with chronic kidney disease or liver disease, they're at a higher risk.
Right. And so those are just a couple of the big ones that really will hit home with some of the people, with so many people. And there's a lot of people that you come in contact with that have these issues. And they may look good on the outside and you don't know that they have this problem. So it's really important that you understand and treat people with respect and the distancing that is required and being asked by the CDC.
Unfortunately, there are some disparities that are coming to light that have always been there. And there's a demographic of population amongst Black Americans and Latinos that makes them a higher risk patient. Most of these Black Americans and Latinos have higher rates of hypertension, have higher rates of diabetes. They're more likely than their non-African American, non-Black community, non-Latino community to have further complications based on their comorbidity.
Right, and there are plenty of studies that are showing that 70% of deaths from COVID across many cities are from Black Americans. So we really need to take this seriously.
Not only that, this demographic and population don't have very adequate access to health care. And if they do, and it's offered through their employer, it's probably that lower tier, lower expense of healthcare. And most of the time, these frontliners, the transportation drivers, the grocery store clerks, they're on the front line. They're in the middle of it. And some of their employers don't even offer health insurance.
Right. And so they're trying to manage the best they can at home. But a lot of the people that live in these communities, these inner city type of communities, it's a more congested area. So you have a higher population of people living together. And then there's that spread. And that just breeds infection anytime you have those people that are so close together. Hello, New York City.
Yes, the Bronx.
That is
got the brunt of this.
Yeah, and it's, you have people that are living close together, and that alone is a risk because they can't social distance. They have, people that are living in their home, and maybe it's not just one generation, it could be multiple generations.
We call that in nursing the sandwich generation.
Right.
When you are caring for your elderly parent or
Right.
grandparent and you are caring for your own children.
Right.
So on top of that, now non-essential workers have been laid off.
Right.
So you did have employment. The little bit of insurance you did have, you just lost because you're non-essential and businesses have been closed and
Right.
are currently closing down.
Right.
That pretty much right now includes barbers, beauticians that have been...
Or people who work in places that wait tables. Some restaurants, although they had the option to offer takeout, they didn't have enough sales to be able to...
The small businesses.
Right.
It affected the small businesses.
Right. They can't say, okay, well, I might have 3 people come in today to order. That's not enough to keep the lights on.
Absolutely not.
So those businesses just close their doors, and anybody who worked there, no matter whether it's the owner down to the people who are busting tables, they all lost their jobs and their income.
These urban populations, which are a lot in the United States, California, New York, Detroit, Michigan, NOLA, New Orleans, Louisiana, they've been hit typically hard because of their condensed population.
Right.
But this isn't the only issue that they have to face when they walk out the door every day. So the CDC tells us we have to wear a face mask when we're out in public.
Right.
Or if we're sick, even if you have a cough,
Right.
they're telling you
Make
don't
sure
leave
that
the
you-
house unless you have a face covering.
Of some sort, correct. And it's all homemade because there's no
There's
mask.
a shortage of surgical masks and N95s.
So you can't walk into your pharmacy or your big box store and go buy a box. They're just not there.
Absolutely. So fears that homemade masks could exacerbate racial profiling and place Black Americans and Latinos in danger due to the recent police news, I guess is what I'm trying to say. In the past, you know, this demographic of people have been racially profiled by the police.
Right.
So now you have to leave your house already being in this demographic, already worrying about being profiled based on the color of your skin,
Right.
or the language that you speak,
Right.
or the religion that you practice, and you have to cover your face. What happens if you only have a blue t-shirt to make your mask out of, or a red t-shirt to make your mask out of?
Yeah,
and
that's
you're in the
not-
wrong neighborhood.
That's not going to set well when you go out. And I haven't seen any particular headlines that have shown any increase in violence yet.
This type of violence.
Right. Well, yes, that's correct. This type of violence. But I wonder, because the recommendation is pretty new from the CDC, how that's going to affect things. And people, you can't assume that because somebody's come in and they have some maybe gang-related injury that it's because they were involved in that. And we shouldn't be making that judgment anyways. As healthcare workers, our job is to take care of the person.
Frontliners,
Right.
first responders,
Right.
and no one should be profiled, period, based on their skin color, religion,
Right.
or culture.
Well, and that's a whole other topic that we could spend a day
talking
We could
about.
spend a day talking about that, just because it's, in my eyes, we're in 2020. That's ridiculous.
Absolutely, I agree.
We're in 2020. Let's move on.
Absolutely,
Everybody.
I agree. Period. We're moving on right now.
So the next little topic that we have is risk for reinfection. So you're sick, you got better, great, you're going out. Can you get this again? Do we know? I mean, there's some stuff that came out today.
Apparently, you
that says
can.
Maybe you can. And most viruses, once you catch it, your body builds immunity and it can fight it off, at least for a certain amount of time. But we don't know if that's the case.
And as we said, this is ever changing. This Corona-19 virus, the information that we gather from yesterday to today to tomorrow is going to be different.
Absolutely.
Today they say you can catch it again,
Right.
be reinfected. So we need to continue to test. This is why it's so important to test. And even though testing is available at the state and local levels, it's still not enough testing because those numbers of patients who are at home with the mild symptoms haven't been tested. So
Right.
we will never, I think, ever really know the true numerical values to this virus.
Well, for worldwide or for the U.S.
Correct.
I mean, we don't have enough here to test people who want to be tested who think that they may have it because they were around somebody who was infected, but they never got symptoms. That doesn't mean they didn't get it. That means they were the 80% who had mild to no symptoms
And recovered.
So we just don't have the answer to that question yet.
So you're asking yourself, what does recovery, what is being recovered from COVID-19 look like? We're thinking, like we said, it's probably higher than we originally thought.
Right.
Because not everybody can be tested.
Right.
Then we're thinking the mild illnesses, the 80% that recovered at home.
Right. But
Didn't get tested either.
Well, not all of them got tested, right?
Correct.
And so we know that, according to Johns Hopkins, that 223,000 people worldwide have covered. And of course, you can go on their website, and that number will change before your eyes.
Well, every day people are recovering, so this is only going to get higher.
Right, and that's great. But as that number gets higher, we're still seeing infection rates go up. I know we are here in the United States. And the big thing to know is, of course, the 80%, it's a mild case, but we do still have 15% who have serious symptoms from this. And that's what's inundating our hospitals with all these patients. And 5% of that, which doesn't seem like a very high number, but that is huge compared to what the flu does every year.
Well, if you break it down numerically, 5% of 100 is 5 people.
Right.
So for every 100 people, that's 5. And then you have 200 people, so then that's 10 people.
Right.
So numerically, it adds up.
It does, and we just don't realize that until you look at what it looks like worldwide, or even if you just say, hey, I'm just worried about the United States. It's kind of a bad
way to look at it.
It is a bad way to look at it.
You would like to think that your neighbors...
It didn't start here, but it came here real fast.
Correct. And you would like to think that your neighbors are being honest and sharing information.
Oh.
But that's a whole nother
That's a whole other podcast.
So, Ashley, tell me, what is the CDC's recovered mean?
And so what they're looking at is no fever for at least 72 hours. And that's without fever-reducing medicines, acetaminophen, ibuprofen, naproxen, things like that. Improvement in coronavirus-related symptoms. Your cough, your shortness, whatever your symptom was, it should be getting better. A period of 7 days needs to pass since your first symptom appeared. You should be self-quarantined for 14, so
Absolutely.
That should take care of that automatically if you're listening to those recommendations. And if you can get tested, you should have 2 consecutive tests, 24 hours apart, and they both be negative.
You can still have, lingering symptoms. We all know with the flu, the common cold, any upper respiratory infection, that you're going to have fatigue. It's going to make you feel tired.
Right.
And you're going to have this cough.
Well, right. I mean, you have a post-viral cough for up to 12 weeks. It's a long 12 weeks, and most people recover before then, but it can happen.
It's the thing that stays the longest.
Absolutely. Another thing we like to touch on is what we have seen a surge in, unfortunately,
since the quarantine
has started, which is domestic violence.
I came across this article the other day, and actually quite a few now within the last few weeks, in which people that are already in domestic violence homes are being quarantined. They're spending more time with their family, and there's an increase in domestic violence activity. Usually there's an influx around Christmas and summer vacations, but with this shelter in place and mandatory quarantine order, it's gone up. So,
and we knew that it would. That was something that we knew, that even our government knew once we quarantined that this was going to take a surge.
Absolutely. This is a different type of domestic violence. They actually have a word for it, and according to Wikipedia, it's called intimate terrorism. So the abuser in this relationship usually uses coercive control and power over their partner, threatening them, intimidating them, and isolating them further. Because
Right.
now they already have you alone.
Absolutely.
And so now they're isolating you even further.
Right.
You can't use the phone, you can't use the internet, there's nowhere to go because you're in quarantine. So studies show that abusers are more likely to murder their partners and others in the wake of personal crises. And this is a crisis.
Well, not only is COVID a crisis, but you throw one more thing in there like, oh, you lost your job, then you have a financial crisis. And that's just adding fuel to the fire.
And finances were hard before this.
In most situations, yes.
And now it's to the breaking point, hence the stimulus checks from the government that are on their way.
Right.
So they know it's an issue, that finances are an issue. There was already a stressed and fractured system in place for those victims of domestic abuse. So now you have a shelter in place command.
Mhm.
You have a minimum of 10 people that you have to socially distance to 6 feet. So something that was already a broken system is now more broken because there's an influx of calls to domestic violence shelters,
Mm-hmm.
and they can't take the people in.
Right. I mean, we live in the state of Virginia, and in the month of March, there was an increase in calls to the emergency domestic violence hotline by 76%. That's huge.
76 is a lot, and that's just in Virginia. So imagine if you added all the other states, because there's still 49 other ones.
Right. And these are the people who are just actively seeking help. I mean, there are a portion of people that are in these domestic violence situations that are scared to reach out.
Yeah, they sit in silence.
They sit in silence. So that number is not, it's an increase in 76% of domestic violence.
Those are just
Those are just the ones that are reaching out, that are
asking for help.
And we know that there's more. We've always known that. And so 1,000 people have sought overnight shelter in the state of Virginia from domestic violence. So we will provide the numbers for Virginia and the national numbers to call if you have or need help and you're in a domestic violence situation.
Absolutely. We want everybody to be safe. We want everybody to be safe from COVID-19.
Right.
And we definitely want everybody to feel safe in their own home.
Right. And this episode really just shows COVID, the pandemic, is awful, but it reaches out so much further than just the hospitals. It's reaching people that are living in impoverished situations. It's reaching people who are in domestic violence situations. It's reaching to everybody. And we have to understand that as healthcare workers, we need to be looking for that when we see patients that come in.
Absolutely. This COVID-19 virus, these issues have been going on a lot longer than this virus has,
Mm-hmm.
and these issues will still be present when the virus is gone. So the virus didn't create the surge in domestic violence. It's just always been there, and it's not really until this moment that it's really being brought to light.
Right.
Along with the other disparities amongst the Black and Latino communities.
Right. And so that we just have to remember, no matter what, these are our neighbors. Whether you think of, Tennessee is our neighbor to Virginia, or however you want to process that, we're all one place and we all need to make sure that we're taking care of each other.
Absolutely.
And we think that this is a great opportunity to connect with your loved ones. You can't be there in person, but you can pick up the phone, you can call them, you can check on somebody, social media, use whatever kind of video option that they have, that you can have, just to see each other's face and connect. It'll not make you feel better. Or
it may make you feel better.
Exactly.
And the other person.
It'll make you both feel better.
Absolutely.
So
I drove by my family's house today and was talking to them through the glass door.
Right.
We will link our references on our website, which is www.thenursingpostpodcast.com. Be sure to subscribe to our podcast, and you can follow us on Facebook, Twitter, Instagram, and YouTube. We want to thank you for listening to The Nursing Post.